I just want to touch on a few items about COVID-19. I know everybody's stressed. I know everybody's have different opinions of what's going on. I just wanted to clarify some issues and just sort of alleviate some concerns. First of all, is this serious? Absolutely, it's serious. Is the sky falling? No, the sky's not falling, but this is serious. I think COVID-19 is certainly something that we need to respect, not fear, but certainly something that we need to respect. I'm working around it every day, and I know you are too. I'm respecting it, I'm taking precautions, but I'm certainly not to the point of being so fearful that I'm making mistakes or being sloppy. Again, make sure that you're doing what you're supposed to do, wearing your PPE, and we'll talk a little bit about that in just a few moments, but just make sure we're using good hand hygiene. Everybody that I've talked to that are getting hammered with this throughout the country are just continuing to hound on, make sure that we're doing good hand hygiene. Soap and water, if you're out on a call, the alcohol-based hand sanitizer greater than 60% alcohol content. So things like that, don't touch your face, don't touch your head, wash your hands before you eat, wash your hands before you drink a drink, things like that. So just keep that in mind. A couple of things I want to talk about with sort of Tuscaloosa specific though. One is trauma patients. We have never really thought until the last couple of weeks about trauma patients being COVID-19 patients, but we're seeing more and more of those. And I talked with a friend of mine at UAB who's one of the trauma surgeons there, and they had checked their trauma ICU as of yesterday actually, and out of the 26 patients they had in trauma ICU, 14 of them were positive for COVID-19. Now again, that's Birmingham, they have much more prevalence of it than we do, but still that's something we need to keep in mind. If the patient's unconscious, can't talk to us, etc., make sure that you're treating those patients like they're COVID-19. And well, what does that mean? Well, wear your mask, put an oxygen mask on them. We're going to put an oxygen mask on these patients anyway, usually. If we put them on an oxygen mask, the CDC has said that the oxygen mask will suffice for a mask over the patient. So just treat those patients like they have COVID-19. When you call TCC, they're actually going to ask some screening questions about COVID-19. So just bear with them. They're trying to get this information so they can relay it to the hospital so that they can prepare. But as a general rule, we're going to probably treat most every trauma patient, especially if they're unconscious and can't talk, like they have COVID-19. So just keep that in mind. All right. What about N95 masks versus surgical masks? Well, most people and CDC recommends, and this is what I'm doing, if I'm just treating patients, I'm going in and treating patients without doing a procedure that's generating aerosols, intubation, etc., then I'm just using a regular surgical mask. Surgical masks are absolutely fine for routine patient care. You're going in, seeing the patient, they're coughing. Obviously, we need to put a mask on them, but put your mask on first. You don't need N95 masks for general patient care. But what we do need to do is, if we're going to intubate that patient, and we're going to talk a little bit about that in a few minutes too, but if we're going to intubate that patient, we're going to put a King airway down. If we have to give them a nebulization treatment, and we're going to talk about that in a few minutes as well, then make sure you got your N95 mask on. Anything that potentially could generate aerosols, make sure you have that N95 mask on along with a face shield. But again, 95% of what we're doing can be treated with a surgical mask, so just keep that in mind. All right, one thing I think, dovetailing about the trauma patients, I think we need to treat every patient for the time being like they're positive. Now, that doesn't mean we have to gown up or put turnout gear on to go in these homes. Just make sure that we're wearing a mask. Surgical mask is fine. When you get in, if the patient's coughing, etc., just put a surgical mask on them. All right, so let's talk about aerosolization and procedures. One thing that I think we need to steer away from, at least for the interim, is on cardiac arrest. I'd rather you not intubate. Now, I'm not telling you don't intubate, but I would steer away from that and go to a King or an iGel, whichever one you're going to use. But I would go to a blind insertion airway device without intubation. Intubation is fraught with risk, Most healthcare professionals are getting infected through procedures that generate aerosol. So try not to intubate. Try to just put a King Airway or an iGel in. Lots of people are steering away from nebulization treatment for the same reason. Aerosolization. We don't want anything that's going to generate aerosols. What I've told people is under no circumstance does a patient really need a nebulization treatment in the back of an ambulance. That's a confined space, and if you happen to absolutely have to do that, then you need to be gowned up with a gown, mask, eye protection, everything. But before you give a nebulization treatment, you need to call medical control, or you can call TCC and get in touch with one of us, and I'm going to talk about that in just a few moments as well. So one thing that I think you need to make sure is, again, on nebulization treatment, that is far down the line of procedures that we should be doing during this time. If you do want to give a nebulization treatment, you haven't transported and the patient can tolerate it, then put them on the front porch, get them outside. You can give them nebulization treatment. Stay back 15, 20 feet, let them take their nebulization treatment if you don't think they can get to the hospital without one. So, that's one thing that I think you need to keep in mind. What about DCHS process right now? Well, the process at DCH has changed a little bit, and respiratory complaints probably are not going to come into the main ED like you normally do. We have isolated 2 different areas of the emergency department. If you come in as of yesterday, trauma 7, 8, CC1, CC2 have been partitioned off with a temporary wall. That's our hot zone for acute respiratory illness patients. The what we call our zone C, which is sort of in the back, we have 16 rooms. That's our COVID area as well, and we actually can treat acute, critically ill respiratory patients back there as well. So really important that you call in. Give us a lead time because we're going to tell you where to go. If you're coming in trauma 7, trauma 8, CC1, CC2, you're probably going to pull in like you normally do, but there's a door that goes into the hallway between the medical tower and the main hospital. There's a door there sort of at the back. That's where you're going to come in, and we'll have someone directing you to those areas. If you're going to come into zone C with somebody that's probably less critical, then there's a doorway just east of the main entrance of the ED. That's the old entrance that used to go into the physician lounge and the mailboxes years ago. We just built a ramp there, so you will maybe directed there. So just keep that in mind. Call us, give us plenty of lead time so that we can get somebody out there to direct you to where you're going. All right, so going back to intubations, nebulization treatments, I can't impress upon you to really think about that before you do that. Some of you have been, have probably read the memo about calling TCC. One thing that TCC has done, and we did it for the Ebola response, and now we're doing it for the COVID-19 response, is if you have a question, you can actually call TCC and they will connect you to either me or 2 other physicians that I have helping me, that all of us are EMS board certified. So we will actually get on the phone with you, they'll patch you through, and we can answer your questions. Now that is not just, well, I think this patient has COVID-19, I'm going to transport them. Those are not the type of things that you need to call TCC about and tell them about, that. What this line and what this process is for is to call if you have a question about hospital destination, just questions that probably medical control cannot answer. We're always more than happy to talk with you, but again, if you're just transporting the patient and you really don't need, I guess, detailed information or detailed advice, and use your local medical control. Recapping a little bit, trauma patients, always treat them like they're COVID-19 for right now. Treat every patient like they're COVID-19. Wear a mask when you go in. Remember about the DCH process. nebulization process and nebulization aerosolization procedures, I can't impress upon you enough to make sure that you're not doing that. I really do not want you intubating right now. Again, going to the iGel or the King Airways or whatever BiAD you want to use. But again, if you have any questions about whether to give a nebulization treatment or any other question, then get on the line and call medical control, and we can help you and give you advice. All right, thank you.